Thank you, Mr. Speaker. Mr. Speaker, Canadians across the country have written to me repeatedly expressing their anxiety over the lack of quality services for seniors, especially and including the slashing of services to veterans. In Thunder Bay Superior North, my constituents are extremely concerned about how the Conservatives plan to deal with their growing problems. Healthcare is a priority for Canadians, and the Conservatives have not adequately addressed the needs of our seniors. As Canadians, we pride ourselves on our universal health care that seems to shield us from inequalities sometimes seen by our neighbors in the U.S. We hear stories of how radiation therapy has bankrupted American families, how Americans hesitate to visit the emergency room because they don't know if they can afford it. We listen to these stories and have thought we were protected from this, but our confidence is declining. Not only is the cost of pharmacare too high for most Canadians, the growing demand for long-term care facilities and in-home workers for seniors has not been met with planning or funding or action. The Conservatives should realize by now that our growing senior population will require more long-term care facilities, and that there is a huge demand for residential care as well, as many seniors wish to remain in their homes and with their loved ones as long as possible. Unfortunately, the supply of in-home care is simply insufficient. We are not doing enough to support in-home care for our seniors. As a result, many seniors are forced into expensive acute care beds in hospitals that are better used for other patients. This is hugely inefficient and winds up costing our seniors more than they can bear and our healthcare system even more. In-home caregivers and services have been praised by those in the healthcare system as being a more dignified and cost-efficient way for seniors to receive the care they need at home. Seniors can maintain their independence much longer and thus have the freedom to manage their lives as they see fit. A part of managing their lives is learning to manage their finances. Seniors need some education on how to organize the financial aspects of their lives in this complex world. Without this, seniors are prone to poverty and a reduced standard of living. Education is one key to keeping our seniors financially stable despite the changing economic climate. It's hard to see what the Conservatives have done to improve health care for our seniors while they've been in power. One thing they have entirely neglected is the vulnerable state of seniors' retirement savings. We need to increase CPP. We know that most Canadians depend on CPP, but with their current benefits, many seniors are falling into poverty. We need to strengthen CPP and protect seniors from the trappings of poverty. The Conservatives have avoided this issue every time it's been brought up. They've done nothing to implement much-needed pension reform and thus leave Canadian seniors worried for their financial stability. Canadians need a national strategy to fight seniors' poverty. The federal government needs to match Canadian sentiment and make this a priority. Thank you, Mr. Speaker.
Honourable Parliament Secretary to the Minister of Employment and Social Development.
Well, thank you, Mr. Speaker. It's a pleasure to answer my colleague's question today concerning the efforts our government has made on behalf of seniors from coast to coast to coast. I welcome the opportunity to respond to the member from Thunder Bay Superior North's concerns. First of all, his assertion that nothing's being done at the federal level for seniors is completely and utterly false. This is exactly why our government launched the Information for Seniors and Information for Caregivers portals on our seniors.gc.ca website. Now, these new programs introduced by our government allow seniors and their families and caregivers to easily find information on federal, provincial, and territorial services which seniors can utilize. And as you know, Mr. Speaker, seniors' issues are the responsibility of all three levels of government in various jurisdictions across the country. And just this fall, we published another helpful resource, the Government of Canada's Action for Seniors Report. This demonstrates how the government works across departments and agencies to support seniors. One visit to this website or read through the report, and it becomes very clear that there is, in fact, a great deal being done for seniors by the federal government. Now, for example, largely due to the sound management of our public pensions, Canada now has one of the lowest levels of seniors' poverty in the world. And further than that, since 2006, our government implemented the biggest increase in the guaranteed income supplement in over 25 years, lifting hundreds of thousands of seniors across the country out of poverty. And while every bit of financial support helps our seniors, we also recognize the importance of staying active and staying engaged. Now, this is why the Minister of Seniors, to that end, and the Minister's National Seniors Council recently released a report on the social isolation of seniors, which is some key information on how to tackle this issue of isolation and inactivity by seniors. And one way is through the New Horizons for Seniors program. New Horizons funds supports projects for intergenerational learning. However, there are seniors in Canada who need more help. It pains me to say that estimates we have say that between 4 and 10% of seniors across Canada experience some form of abuse. And that's why we adopted the Protecting Canada's Seniors Act. Now, this sets tougher penalties for elders' abuse. And we also developed financial literacy strategies that specifically respond to seniors' needs. Mr. Speaker, those are just a few of many programs, services that we provided for Canadian seniors across the country. I would like to address one further thing the member across spoke about, which was healthcare issues. And as we all know, the delivery of healthcare in Canada is within provincial jurisdiction. The Government of Canada's role is to make sure the provinces have the resources to provide equitable service for healthcare for seniors and for all Canadians from one end of the country to the other. And that's why we have increased healthcare transfers to the provinces each and every year we're in office, and those increases will continue, Mr. Speaker. So we are actually now increasing money to the provinces at a rate more than the provinces are actually, in many provinces, actually increasing their own spending on health care. So a lot of the issues the member across the way put forward, we actually agree with. We agree that there needs to be more seniors housing. We agree that there needs to be better health care for seniors in many measurable areas of health care. The provinces have been given the resources by the federal government to deliver adequate and equitable and good health care for seniors from across the country. It's up to the provinces to put programs and policies in place to deliver those health care programs. Thank you, Mr. Speaker.
The honourable member for Thunder Bay Superior North.
Thanks, Mr. Speaker. Our seniors, including our military veterans, need some real action. We can't wait around for the Conservatives to decide it's the right time for reform. Seniors need in-home care. They're asking for it. But what's the government doing to support their choice for independence? I haven't seen a thing yet. Our seniors are asking for help, and the system is failing them. CPP and seniors' poverty have been ignored for far too long. Benefits simply need to be increased. The Conservatives are putting seniors at risk. We need a national strategy to combat seniors' poverty, as well as children's poverty, for another evening, immediately. Seniors need to be respected and supported in the workforce. The Conservatives need to ensure that employers are supportive of older workers and support these businesses with the right incentives. Will the Conservatives please step up and invest in proper pensions and quality of health care for our seniors? Thank you, Mr. Speaker.